perfect. So you are here for a cranial nerve examination, right? Perfect. Now, before we start, which we'll do in a minute, a few things. First things first, this cranial nerve examination is being recorded for our local university, so if you don't mind that, we could then of course proceed. Okay, very good. And then let me just get a few details. So I've read the info that you gave us, and just to make sure that it's really you, we have to ask all the same detail once again. So if you could please give us your full name and the address you're living at the moment. Okay, perfect. And then please give us the contact address that you contacted us from. Email address, of course, yeah. Perfect. See, no problems at all, just standard procedure stuff that we have to do. Okay, so you're here for a cranial nerve examination. Now, this is going to be divided in a few parts. We'll start with a few basic tests of your vision. Now, the first thing you'll have to do is I'll wave my hand around a bit, and you just tell me at what point my hand enters your field of vision. Okay? Perfect. That's really all you have to do. So I'm gonna move my hand from up here, and you say stop when you see my hand. You see it now, right? Perfect. From the bottom too. Okay. And down from here. Nice. And here. Correct. See, you figured it out really quickly. From up here. Down there. Once again from the top. Okay. And then from the bottom as well. Perfect. Now, what I'm gonna do next is I'll do the same thing, but with both sides simultaneously. So, can you see my hands now? Both of them? Yeah. Okay, barely. Okay, perfect. Now I'm just gonna use my fingers. Can you now see both of my fingers? Perfect. And with this, can you now see both of my fingers? Yeah. Okay. See, very, very simple and easy. Okay. Now, next, I want you to just follow my hand, or let's do index finger. Just follow my index finger, please, and just look at it while I take a little look at your eyes. Okay. Perfect, you're doing really good. If the finger at any point leaves your field of vision, just look at it as if it was still there, but it shouldn't. Okay. Just okay, perfect. See, no problem there at all. Now, what I'm gonna do next is I'm gonna get a light, just a tiny flashlight, no big deal, and I'll use that to kind of examine your eyes a little bit closer. So if you don't mind that, that would be perfect. See, perfect. Okay, let me just grab over here and get the light now. A few people might have some problems with a light this bright shining into their eyes. If they feel uncomfortable at any point, please just tell me and we can stop the procedure. But if everything is alright, then I'll of course begin now. Okay, now let me just take a look. Okay, interesting. Everything seems to be in perfectly good health. I'm going to come a bit closer with the light. Okay, interesting. Let me just hold off one of your eyes. Okay, and now the other way around. I'm sorry. Sometimes eyes have a little trouble adjusting to the light, but should be good to go. I'll take a few more looks in just a second, but what I want you to do first is the same as with the finger. Just follow the light, okay? Just follow the light. just follow the light. Perfect. Follow the light. Okay, I think that looks all good and healthy too, so just to be sure, I'll take one of my utensils over here, and I hope you don't mind if I come a little bit closer with this one. Let me just take the light as well, and I'll give your eyes a better look now. Okay, yeah. Okay. Okay, yeah. Yeah. Okay. Okay. Okay, perfect. Yeah, you're doing very good, very good. Okay, so there is a little thing that I'd like to check that I just saw. Nothing to worry about. I'll just look, I'll hold off one of your eyes, and I'll hold up a selection of fingers with the other. You just tell me how many fingers I'm holding up, okay? Perfect. So I'm gonna hold up one of your eyes. Is this good? Comfortable? Okay. And now just tell me how many fingers you see. See? Perfect. Yeah. Correct. Yes. 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 Correct. Okay, nice, perfect. Now we'll do the other eye, just for good measure. Correct. Yes. Right. Perfect. Correct. 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 And one last. Nice, perfect. See, no problems at all with your vision as far as I can tell. Now, wait, what? Okay. Okay, so if you're not sure about your eyesight, okay, then I'll take another look. Now, this is another tool that we use sometimes. Similar to the one I used before. It's also just to get a better look at your eyes now. Let me just open this up. And I'll get this little thing here. Okay. Okay. Yeah. Where did I put my flashlight? Of course, there it is. Okay, just look at the wall, please, and I'm just gonna try to confirm. Okay, so you say you sometimes see a bit blurry. Okay. In what situations is that? Okay. Okay, now just gonna shine from up here. Okay, yeah. I'll give it a look, but it might be that your eyesight is really not the problem. It's just something that some people tend to have, that they sometimes seem blurry. It might be because your eyes are cleaning themselves because of tears, then that you see a bit blurry. Okay, but so far everything looks good. No problems. No. I think you don't have to worry about it at all. It just sometimes happens that maybe because of tears, maybe because the lighting is a bit weird, especially if you say this happens at night mostly. It just sometimes happens, and that's nothing to worry about. So, okay, now that we got past your eyes, let's go for a hearing test. I'm gonna put these headphones on your ears, and you'll hear sounds from the left and the right side, and you just have to tell me when where the sounds come from, just say left, say right, and then afterwards you'll hear a instructional. It's about 1 minute long, just a few instructions, something like raise your right hand, raise your left hand, and stuff like that. So just follow the instructions, and you're good to go. Okay, now let me just put these on the right way. Okay, perfect. Are they sitting up? Perfect. Okay, now I'm going to start the program. You just tell me, do you hear the sounds from the left or the right? And then afterwards, just tell me, or don't tell me anything. Afterwards, I'll say when I start the program, you just need to follow the instructions in the program, and I can just look and see if you follow everything correctly. Okay, perfect. Now, I'm going to start the program now. You didn't notice, there were two lights behind you that always turn on with the audio, just in case you were wondering. Well, I know when you're correct, but don't worry, it confuses a few people at first. Anyway, now you'll get the instruction instruction audio, of course, and just follow the instructions. It's very basic, very simple instructions. So I'm gonna start the program now.
Please raise your right arm. Please lower your right arm. Please raise your left arm. Please lower your left arm. Please raise your left arm. Please raise your right arm. Please tap your left elbow. Please lower both arms. Please look at the wall to your left. Please look at the ceiling. Please raise your right hand above your head. Please look at the doctor. Please lower your right hand. Thank you.
Perfect. Okay, I'm gonna take these off of you again. And yeah, there were no mistakes. Let me just put that down right quick without making too much noise. No mistakes at all. Your listening abilities are absolutely up to the standard. No, they're top notch, no problem there. It's like 2020 audio. It's not vision, it's audio. Don't worry. Yeah, I'm not the best comedian, so no need to laugh. It's not funny. Now, what I'm gonna do last is I'm gonna inspect your face. Now, I'm gonna come up close, but don't worry, nothing closer than I have already come. And you seem to be fine with that. Is that correct? Okay, perfect. And then I'll just inspect your face a bit, test a few of your muscles, and yeah, then afterwards we're pretty much finished with the exam. So I'm just gonna come up close and let me just, okay. Now can you just grin? Yeah, perfect. Okay. And clench your teeth, like clench your teeth. Okay. Yeah. Okay, nice, perfect. Okay. Now can you clench your lips, not your teeth this time, okay? Nice, and raise your brows. Okay. And can you, I don't know what's it called, can you do this where you get the wrinkles on it? Yeah, perfect. You understand what I mean? Okay. raise your eyebrows again, please. Okay. Okay, that seems to be in perfectly good condition as well. Well then, I have good news to tell you. Absolutely no problems at all with anything I inspected today. You can of course come for further checkups if you desire, but I don't think you'll need any further checkups. You have been perfectly good condition, so glad to have you here tonight. You were of course very, very nice, and thank you for laughing about my joke. If you ever feel the need to come back, please just shoot us an email, give us a call, and then we can manage a new appointment. And yeah, there's not going to be a need if you stay in that condition for quite a long time. Okay, thank you so much, and I